X-linked dystonia Parkinsonism, a pathophysiology presentation by May, Cherry, Lahia, and Vanessa. What is X-linked dystonia Parkinsonism? XDP is a neurodegenerative movement disorder characterized by adult-onset Parkinsonism that is frequently accompanied by focal dystonia, which becomes generalized over time and that has a highly variable clinical course. It affects mostly males and typically presents in adulthood with either focal dystonia or more commonly Parkinsonism. Over 500 cases of XDP have been reported in the literature to date. What is the pathophysiology of XDP? It is inherited in an X-linked recessive pattern. The gene associated with this condition is located on the X chromosome. Males are usually affected by the disorder because they only have one X chromosome. Females have two X chromosomes. A mutation must typically occur in both copies of the gene to cause a disorder. However, a female with one altered copy of the gene in each cell are called carriers. They are usually asymptomatic. Few females with the altered gene have developed movement abnormalities but milder and are usually not progressive or disabling. How is XDP inherited? If the father carries a defective X chromosome, all the daughters will be carriers and the sons will be unaffected. If the mother is the carrier, the daughters have 50% chance of being a carrier and the sons have 50% chance of being affected. What is the etiology of XDP? XDP, or also called Lubag or twist in English, is a progressive disorder that leads to neurodegeneration. XDP is associated with a mutation that occurs in the gene TAF1, which creates various set of instructions for making proteins. When variations happen, it will then cause abnormalities in the normal function of the nerve cells. But scientists are still not sure how these variations relate to the abnormalities found in XDP. However, they suspect that the changes disrupt critical genes in neurons found in the caudate nucleus and putamen, which are critical for normal movement, learning, and memory. What are the signs and symptoms of XDP? Symptoms can occur as early in adolescence and as late as in the 70s. Early symptoms include Parkinsonian, tremors, bradykinesia, rigidity, poor balance, and shuffling gait. Later on, dystonia symptoms develop in the limbs, tongue, pharynx, and larynx. With such symptoms, jaw dystonia develops and is followed by cervical dystonia, which affects the neck and shoulders. What are the prognosis of XDP? In males that only develop Parkinsonism, the disease progresses at a very slow pace and usually non-disabling. The males that have complications within the first 2 years of the disease with dystonia will develop infections, pneumonias, and laryngeal stridors, which will usually lead to an early death. What are the complications associated with XDP? Complications include difficulty with speaking, swallowing, coordination, and walking. A few years after signs and symptoms appear, patient may die prematurely due to breathing difficulties, pneumonia caused by risk of aspiration, and depression as they become dependent on the care of others. How is XDP diagnosed? A physical examination of the facial features, the distance between the eyes, and the length of the arms and legs is conducted. Neurological and ophthalmologic examination can also help diagnose XDP. X-rays, CT scans, and MRI are used to see the structures inside of the body. Lab tests may use genetic testing to diagnose genetic disorder and to also measure the levels of certain substances in blood and urine.
created using presentoon.